For power toothbrush, what is ADA specification number? For power toothbrush, what is ADA specification number? That is 120. That is 120. So check out the next one. What is the most striking clinical feature of gingivitis during pregnancy? What is the most striking clinical feature of gingivitis during pregnancy? Yes, it is ease of bleeding. Ease of bleeding, option B. Options are very cool. Ease of bleeding. Question number 13 is also done. What is the primary cause of gingivitis during pregnancy? What is the primary cause of gingivitis during pregnancy? Yes, already discussed the primary cause of gingivitis during pregnancy or any condition. The answer is bacterial plaque. The answer is bacterial plaque. Now, the next important thing, as we have already discussed few things about this brushes. Okay, so bristles. The hardness of bristle is directly proportional to diameter. As the diameter of bristle is increased, d square, the hardness will be improved. And it is inversely proportional to length. The more the length of bristles, the less the hardness of a particular brushes. Okay, so proportional to d, inversely proportional to L square. Proportional to d square and inversely proportional to L square. Similarly, you have one more classification related to the bristles, that is soft bristles, medium bristles, hard bristles. Soft are dimensions is 0.2 millimeters or 0.07 inches. Medium is 0.03 or 0.012 inches. Hard is double that of soft, that is 0.4 millimeters. And it is double that of 0.07, that is 0.14 inches. Okay. How I used to remember is, I used to remember, soft is very easy to remember. Soft starts with S. 2 means second. Second starts with S. 0.07 inches. 7 starts with S. Soft to hard is double. Soft to hard is double. Clear? Done? Next one, again, you have different types of intraproximal cleaning devices, right? So what is the first one? First cleaning device. Yes, toothpick. What is the name given to toothpick? Have any specific name for toothpick in dentistry? In perio at least? Anyone? No? The name given for toothpick is stamudent. Okay, it is called as stamudent. Triangular toothpick is called as stamudent. Is preferred for interproximal cleaning in the anterior zone. So what is the second device? Option B. What is the second one? What is the second one? Wait. Give me the answers. Screen is not visible. 100 people will ping screen is not visible. When I'm asking answers, no one is going to respond. I can see your screen is visible or not. Visible now? Okay, tell me what is the answer. B. What is B? What is B? Please answer. Screen is not visible. Again, B is also toothpick. Huh? Single tufted brush, B. B is toothpick toothpick plus handle. You can say handle, right? This is handle. This is a toothpick. So what is the name for toothpick plus handle? What is the name of toothpick plus handle? The name of toothpick plus handle is called as perioid. 2 marks question. 2 marks question is there, right? Perioid final year theory exam 2 marks question. It's right. Perioid. Then next comes is C, D, E, F. So all these are interproximal brushes. All these are interproximal brushes where G is a rubber stimulator. Hope you are writing. This is question number 18. Hope you are writing. This is question number 18. Done? Okay, very good. Right. These are like very simple few more diagrams from your Karanza. A triangular wooden toothpick was also is so popular with the patients. The tip is inserted between the teeth with the triangular portion resting on the interdental papillae. The tip is moved up and down to remove the plaque. This is what most of the people will do. The second diagram is talking about the toothpick plus handle. This is called as perioid. This device is called as perioid. And what happens is, what is the use of interproximal brushes? Like you can clean the interproximal area with the floss. But whenever you have a concave or irregular areas, this is a concave area, whereas in irregular areas, or whenever you have a concave and irregular areas. So what happens is your toothpick, your interproximal floss, the floss cannot be used to clean such areas. So in such areas, the best method, like whenever they're asking like the best aid for cleaning these interproximal areas, whenever you have a fluted or whenever you have a irregular or whenever you have a concave proximal surfaces, the best methodology is an interproximal brush. Okay. Similarly, along with the interproximal brush, okay, you have something called as powered flossing devices. Because normally, can you tell me what is the length of floss that is regularly taken to floss, or that is regularly taken to tie your retainer, or that is regularly used to tie your endodontic file whenever you're doing endodontic procedure? What is the thickness of floss? Not 4 inches. It's a question in your pedo. Yes, Shruti is right. The answer is 18 inches. Very good, Shruti. The answer is 18 inches. So 18 inches is a very frequently asked question. Pedo, this question was already discussed in the class. Okay. So, but few patients are not comfortable with this hand flossing technique, loop technique. All these techniques will be there. So it's very, very difficult for them to do this. So for such patients, they have invented something. Okay. Laziness is the invention of the new era, right? So there is something called as powered flossing devices for the ease of the patients. Okay, right? The tip is inserted interproximally, and this is how the circular motions and everything motions will be done, by which the cleaning will happen. Okay, so but most important area is the other side of your the content, that is type of embrasure. So how the interproximal type of embrasure is there? Basing upon the type of embrasures are divided into type A, type B, and type C, and different types of embrasures basing upon their interproximal gingival area, the mode of cleaning will be different. Okay, so normal gingival embrasure with no gingival recession, that is your type A, no recession. Okay, what is the mode of cleaning? The mode of cleaning is floss. Type 1 or type A embrasure, what is the mode of cleaning? Answer is floss. Type B, where there is exposure of root surface, type B, The mode of cleaning is interproximal brush. Type C. Type C, no interdental papillae. No interdental papillae. No interdental papillae. The type of cleaning aid is single tufted brush. Single tufted brush. Okay. Right? Clear? Clear, guys? Type of embrasures and their cleaning aids. Okay. Now tell me, what is the condition where you don't have specific shape of interdental papillae? Already discussed in your pro life. Condition where you don't have a specific shape for interdental papillae. Ortho question. Yes, right. The answer is midline diastema. Midline diastema. Shape of interdental papillae in midline diastema. No specific shape. No specific shape. Okay, right. Very good. So 18 you are done, right? 18 you are done. Okay, 18 you are done. 19 diameter of bristle used in soft toothbrushes. Diameter of bristle used in soft toothbrush. 17, question number 17. Diameter of toothbrush used in soft toothbrushes. Yes, 0.07 inches. If they're asking millimeters, what is your answer? If they're asking in millimeters, what is your answer? Yes, if it is in millimeters, the answer is 0.2 millimeters. The answer is 0.2 millimeters. Very good. Done. Okay, done. Okay. So now I'll talk a little bit about some systemic conditions which are important causing periodontal problems. Okay. What systemic conditions? What is the habit which is causing more periodontal problems? Which bad habit is causing more periodontal problems? Let's try to brush. Yes, right. Very good. Smoking. So you have very important topics, smoking related to periodontitis, very important topic, smoking related to periodontitis. Even using of alcohol is also one of the reason which is going to cause periodontal problems. Now tell me, what are the systemic conditions can lead to periodontitis? Most common systemic conditions, what you know? Yes, Gayatri, right? Diabetes. Okay, one more is obesity. Obesity can lead to periodontal problems. Increasing in the weight. That is nothing but called as obesity. As weight increases, the periodontal problems will be more. As weight increases, the periodontal problems will be more. Right. Next goes, there is something called as metabolic syndrome. We'll discuss about that. There is something called as metabolic syndrome. Metabolic syndrome can also cause periodontal issues. Metabolic syndrome can also lead to periodontal problems, periodontal issues. Okay. Right. So now I want you to check out question number 14. Question number 14. Very important thing about the obesity. Which characteristic of obesity is associated with increasing in the production of cytokinins and dysfunction of immune cells contributing to periodontitis? Because we told obesity lead to periodontitis. How it is leading to periodontitis is, yes, of course, it is causing an increasing in cytokine production and T cell and monocyte macrophage dysfunction. Obesity is causing cytokine production more and dysfunction of this T lymphocytes, monocytes and macrophages, thereby decreasing the immune, thereby hindering the immune system and leading to more periodontal breakdown, right? The answer is B. Please do mark that question, question number 14. What is the mechanism that happens in obesity individuals? What is the mechanism that is happening in obese individuals? Next one, similarly, I want you to make a note about whenever they're talking about obese, whenever they're talking about metabolic syndrome also. Okay, the important thing that you have to make a note is 6 alpha. The important thing that you have to make a note is 6 alpha. The important thing that you have to make a note is 6 alpha. What is the 6 alpha? The 6 alpha is 6 means interleukin 6. Alpha means TNF alpha. 6 means interleukin 6. Alpha means TNF alpha. Okay, that is your question number 15. Which pro-inflammatory cytokinins are known to be elevated in obesity individuals and contributing to periodontitis. That is interleukin 6 and TNF alpha. And hope you have done periodontal pocket. Okay, periodontal pocket, a video of my smart video. I have covered this. Okay, question number 16. Pus in periodontitis is? Pus in periodontitis is? Yes, pus in periodontitis is not a very, very important sign. It is basically called a secondary sign. It is going to tell you about the nature of inflammatory changes or inflammatory process. Pus, the type of pus in the periodontal pocket or from the periodontal pocket does not influence the outcome of the treatment. Okay, does not influence the outcome of the treatment and does not, does not change the mode of treatment or the type of treatment. Clear, right? It's a secondary sign. It's a secondary sign. So as I said, like some systemic diseases, we'll try to learn few important points about the systemic diseases, particularly metabolic syndrome, because there were few questions on this metabolic syndrome in the INICET. So we'll talk about this. So what is metabolic syndrome? Anyone know what is metabolic syndrome? What is the definition of metabolic syndrome? Anyone? Metabolic syndrome is basically, according to the textbook, it is basically defined as patient having abdominal obesity. Abdominal obesity. Patient with abdominal obesity plus 2 or more of the following. What are that? One is hypertension. Second one is hyperglycemia. And the third one is dyslipidemia, abnormal lipid production, high glucose production, and high blood pressure. If the patient is having any of these two, along with the basic obesity, that is your abdominal obesity, the patient is considered as having metabolic syndrome. The patient is considered to have metabolic syndrome. Clear? That is the definition which is given in Karanza. So now in Karanza, they have correlated this systemic disease, systemic condition rather than a disease, systemic condition for the periodontitis. Okay, means the patient who are having metabolic, this metabolic syndrome are having a high incidence of periodontal breakdown. Why there is a high incidence of periodontal breakdown is basically there are two reasons which are causing this. The one reason is increasing in the inflammatory response. The second reason is oxidative stress. So both this oxidative stress as well as increasing in the inflammatory mediators, inflammatory response, these two mechanisms are causing periodontal breakdown in the case of metabolic syndrome patients. And these metabolic syndrome patients, because as we said, like these people are going to have obesity plus hypertension. So in the future, this metabolic syndrome patients has more chances of developing cardiovascular abnormalities. Similarly, the patient is having hyperglycemia. So these patients have more chances of developing type 2 diabetes in the future. Clear? Clear, guys? So what is metabolic syndrome? Metabolic syndrome is abdominal obesity plus any of these two features. What are the any of these 2 or 3 features? What are they? One is more blood pressure, hypertension, more glucose, hyperglycemia, and abnormal lipid metabolism. Okay, these patients in the future can lead to CVS problems and type 2 diabetes. And what is the common feature that is seen between the periodontitis as well as this abdominal metabolic syndrome? Metabolic syndrome is both of them are going to have high inflammatory response and both of them are going to have high oxidative stress. Clear? Okay. Now we'll try to learn few important things. Already you're familiar about SE, circular epithelium. What is this circular epithelium? Circular epithelium lines the gingival sulcus. Yes, very nice. It lines the gingival sulcus. Okay. It is a non-keratinized stratified squamous epithelium without retipex. Without retipex. Can you tell me any disease, any skin lesion or any disease, okay, which is having no basement membrane? No basement membrane. No basement membrane is seen in which disease? No basement membrane is seen in which disease? Not pemphigus. Yes, it is gingivitis. Okay, anyway, keep that aside. Okay, so it shows what type of degeneration, that is hydrophic degeneration. Okay, and despite this morphology and chemical characteristic features, the circular epithelium has a potential to keratinize if it is reflected outside. Means if it is reflected and exposed to oral cavity, this non-keratinized epithelium will be converted to keratinized epithelium. If it is kept back, again this non-keratinized epithelium will be converted to non-keratinized epithelium. Okay, this concept is already discussed in your activity a few days back by me. Okay, next one, the important thing that you have to make a note is SC. Okay, you remember like this. So what are the two things which are having semi-permeability? Two things which are having semi-permeability starts with S and E. Okay, yes, one is circular epithelium and other one E for enamel. This is also we have discussed. Circular epithelium and enamel both are semi-permeable. Okay, right. So next, SC is done. So I'll be jumping into JE. So your junctional epithelium is collar-like band of stratified squamous non-keratinized epithelium. Initially, it is 3 to 4 layer thickness. Initially, it is 3 to 4 layer thickness. But the number increases as age increases. The number increases as age increases up to 10 layers or even 20 layers. Okay, initially 3 to 4 layer, later it become 10 to 20 layer. When you're talking about position, okay, so what happens? The junctional epithelium tapers from its coronal end, which may be 10 to 29 cell width, and apically it is 1 to 2 cell width. Apically it is 1 to 2 cell width. What is the length of junctional epithelium? The length of junctional epithelium is 0.25 to 1.35 millimeters. Very, very frequently asked question. Next, this concept is very, very important. Junctional epithelium is basically formed from oral epithelium plus reduced enamel epithelium. It is formed from. But this reduced enamel epithelium is not essential. It's not must to have a reduced enamel epithelium. Means why? There is an example. Okay, normally this junctional epithelium is completely restored after pocket elimination or surgery, and even around implant also, the junctional epithelium is able to form back, because when you're keeping implant, where is your reduced enamel epithelium? Reduced enamel epithelium will be found once in a life. Okay, but even when reduced enamel epithelium is not there, it is forming around the implant. It is formed after the pocket instrumentation, after the pocket surgery. So finally, they have concluded, yes, reduced enamel epithelium is required, but it is not essential for the formation of junctional epithelium. And of course, we have discussed junctional epithelium attaches to the tooth surface by mean of internal basal lamellae and attached to the other side on the connective tissue by the mean of external basal lamellae. This is also we have discussed in the WhatsApp activity. Right, clear? Done. So I'm done with the SC and I'm done with JE. Okay, now check it off. Question number 19. Question number 19 is related to ANAC, which I hope like you're already done with acute infections. One most infection is ANAC. So tell me, a grayish white membrane that is present on the necrotic area in ANAC, this membrane is called as, yes, pseudomembrane. Basically, you're going to remove this pseudomembrane in the first appointment of patient with ANAC. What is the solution that is used? How do you remove this? Yes, right. Gayatri is right. Hydrogen peroxide. I want the percentage. Percentage of hydrogen peroxide. Yes, 3%. Yes, 3%. 1:1 ratio with warm water. Okay, right. Very good. Next, question number 20 is familiar. Length of junctional epithelium ranges from. Length of junctional epithelium ranges from. Very good. Length of junctional epithelium ranges from 0.25 to 1.35 millimeters. Very good. Thickness of junctional epithelium already discussed. Initially, how much thickness? Initially, it is 3 to 4 cell thickness. As age increases, it can improve up to It can improve up to 10 to 20 cell thickness. Coronal end, what is the thickness? Coronal end, what is the thickness? Coronal end is 10 to 29 cell thickness. As it moves apically, it becomes thin. What is the thickness apically? Apical is 1 to 2 cell thickness. Very good. 22, we have already discussed histological examination of the tissue and desquamatogingivitis which rebel. Loss of basement membrane. No basement membrane on histopathological features of a desquamatogingivitis case.